Testosterone injections for men is really easy. This is a bottle of testosterone. It's a 10 ml bottle. It has 200 milligrams per ml in it. And this is a typical syringe that we use. It's a 1 ml syringe. It has little lines on the side that indicate how many cc's we draw up. And a typical dose for most men will be between 0.3 and 0.5 cc's. So basically we would pull up the liquid in this little syringe, and then the shot needs to be done in a muscle. So for most men, I have them take an injection in the quadriceps muscle. You could also turn around and hit the gluteus, the butt muscle, or you could have a friend or a nurse or your wife or a partner or someone could actually even give you a shot in the arm. It's really easy to do. It takes a few seconds and it's done once a week. Now I do have some men who have been a little more sort of proactive in terms of their testosterone, and they split the dose, because what happens when you take the shot once a week is you'll get a nice rise in testosterone fairly quickly. In the first 24 to 36 hours you'll get a peak of the hormone, and then over the next few days it sort of trails off. So by the end of the week, some men experience a drop-off of how they feel from the testosterone. So if men don't mind taking an extra shot, you could take a shot every 3 or 4 days, and that would tend to keep your level more stable without having a big up and a down fall like that. So the only adverse side effects that I've seen from testosterone injections in men is sometimes it causes oily skin and can sometimes cause some acne reactions. There are also other known problems that can develop in men who have big belly fat, because they can convert their testosterone into estrogen, which is called aromatizing. And when estrogen goes up in men, it's bad. They can develop breast tissue, and it can sometimes even be irritating and cause the prostate to swell. But mostly the side effects are minimal, and even if a man does convert some of his testosterone to estrogen or has acne problems and things like that, we can always adjust the dose, and there's lots of different ways to minimize any of these side effects. Basically, testosterone for men is extremely well tolerated. I almost have nobody who goes off of it once they start taking it, and men are generally very happy with testosterone. They feel so much better when they take it. The only known contraindication to taking testosterone is a type of prostate cancer where the cancer is widely metastasized. It's called a very aggressive prostate cancer. It's fairly rare. Most prostate cancer is not very aggressive. It pretty much stays in the prostate gland. And even men who have prostate cancer can safely take testosterone. Men who have prostate cancer don't have a 0 testosterone. So whether you have a 300 testosterone or you have a 600 testosterone, it really doesn't make any difference in terms of the prostate cancer unless you have this very aggressive, widely metastatic type of prostate cancer. So there's been a lot of research done. They used to actually remove men's testicles when they had prostate cancer to see if they could lower the testosterone level, and they found that it really didn't make any difference in terms of the progression of the disease. There's also been a lot of studies on if testosterone causes prostate cancer, and this has also been disproven. There have been studies that have shown that men who have better testosterone levels also have healthier prostates, and they're healthier from every perspective also. So it seems that testosterone is a health-enhancing hormone for men. It makes men healthier from every perspective. You look at blood pressure, you look at muscle tone, you look at weight loss, you look at brain function, you look at bone density, even blood clotting, and testosterone is a health-enhancing hormone for men.